I want you to think about the last glass of water you drank today. Just one simple question. When was it? Was it this morning when you woke up? Or maybe you are watching this right now, realizing you have barely had any water at all today. I am not here to judge you. I am here because what I am about to share with you in the next few minutes could genuinely change the way you think about something as basic and as powerful as water. And for seniors managing blood sugar or living with diabetes, this is not just useful information. This is the kind of information that could protect your kidneys, stabilize your energy, reduce your medication side effects, and honestly, it could add quality years to your life. My name is Dr. James, and I have spent decades working with older adults who are navigating the very real challenges of managing blood sugar, type 2 diabetes, and the natural changes that come with aging. And in all of that time, across thousands of patient conversations, one thing has surprised me more than almost anything else. Most people have never been told how to drink water properly. They have been told to drink more water. They have been handed pamphlets about staying hydrated. But nobody sat down with them and explained what that actually means for a senior body dealing with blood sugar issues. So that is exactly what I am going to do today. Before we get into it, I want to ask you something, and I genuinely want you to answer in the comments below. Do you find it hard to drink enough water throughout the day? Maybe you forget. Maybe you just do not feel thirsty. Or maybe you have heard conflicting information and you are not sure what is right. Tell me in the comments. I read them, my team reads them, and your answer might help someone else watching this video who feels exactly the same way. You are not alone in this, and we are going to figure it out together. Now let us talk about what is really happening inside your body when blood sugar is involved. When your blood glucose levels rise, whether you have been diagnosed with diabetes or you are in that pre-diabetes zone, your kidneys work incredibly hard to filter that excess sugar out through your urine. That process requires water, a lot of it. And here's the cruel irony that most people do not realize. When your blood sugar is high, your body is already losing more fluid than usual through that increased urination. So you are becoming dehydrated precisely at the moment when your body needs hydration the most to function well. Now layer on top of that the fact that as we age, our sense of thirst genuinely diminishes. This is not a myth or an excuse. It is a well-documented physiological reality. The hypothalamus, which is the part of your brain that signals thirst, becomes less sensitive over time. So older adults, seniors especially, can be significantly dehydrated without feeling thirsty at all. You could be sitting in your chair right now, comfortable, not feeling any particular need for water, and yet your body could be running on a deficit that is straining your kidneys, thickening your blood, making it harder for your cells to absorb glucose properly, and contributing to that foggy, tired feeling you might have been writing off as just getting older. That combination, reduced thirst perception plus blood sugar-driven fluid loss, is why I want to talk to you about this today. Because once you understand what is happening, the solution is not complicated. It just requires a little intention and some practical knowledge that nobody handed you before. So let us start with the first and most important thing I want you to take away from this video. Hydration for a senior with blood sugar concerns is not just about the amount of water you drink. It is about the timing, the consistency, the temperature, and even what you drink your water alongside. All of those factors matter more than most people realize, and I'm going to walk you through each one of them. Let us start with timing, because this is where most people get it wrong in a way that is completely understandable. Many seniors tend to drink most of their water in the evening. Maybe they are watching television, they finally sit down, they reach for a glass of water. But drinking the bulk of your water late in the day is a problem for two reasons. First, it means you have spent most of your waking hours in a mildly dehydrated state. And during those hours, your blood was thicker, your kidneys were working harder, and your blood sugar was more difficult to regulate. Second, drinking large amounts of water in the evening increases nighttime urination, which disrupts your sleep, which in turn affects insulin sensitivity the next day. Disrupted sleep and poor blood sugar control have a very tightly linked relationship, and dehydration is often the invisible thread connecting them. What I recommend instead, and what I encourage you to genuinely try for just 1 week, is something I call front-loading your hydration. The idea is simple. You start your morning intentionally and you build your water intake into the earlier part of your day so that by the time evening comes, you have already done most of the work. Here is what that actually looks like in practice. When you wake up in the morning, before you reach for coffee, before you check your phone, I want you to drink 1 full glass of water. Not a sip, not a half glass, a full 8-ounce glass of plain water. Here is why this matters so much. While you sleep, you lose fluid through breathing and gentle perspiration. By the time you open your eyes in the morning, you are already in a mild state of dehydration that has typically been building for 7 or 8 hours. Your blood sugar in the morning, what doctors call fasting glucose, is partly influenced by how well your body was able to regulate itself overnight, and hydration plays a role in that. Starting your morning with water helps your kidneys begin their work immediately, supports the movement of glucose through your system, and, frankly, just helps you wake up and feel more alert. Now, about that morning coffee. I know many of you are not giving it up, and I am not asking you to. But I do want you to understand that caffeine has a mild diuretic effect, meaning it encourages your body to release fluid. So if your morning routine is to wake up and go straight to a large cup of coffee, you may actually be starting your day in a deeper hydration deficit than you realize. The simple fix is to drink that glass of water first, then enjoy your coffee. You are not giving anything up. You are just sequencing things in a way that serves your body better. After your morning water, I want you to think about drinking a glass of water with or shortly before each meal. This is particularly important for blood sugar management for a reason that many people find really eye-opening when they hear it for the first time. When you are well hydrated before a meal, your blood volume is maintained properly, and your digestive system can move food through more efficiently. This helps moderate the rate at which glucose enters your bloodstream after eating. In other words, drinking water before your meals can actually contribute to a smoother, more gradual rise in blood sugar rather than a sharp spike. Now, I want to be clear. Water is not a replacement for medication. It is not a cure for diabetes, and I am not suggesting it works the way metformin or insulin works. But it is a supportive tool that costs you nothing and has 0 side effects, and that is worth paying attention to. A reasonable daily target for most seniors, and please discuss this with your own doctor because individual needs vary based on your kidney function, heart health, medications, and activity level, but a general guideline is somewhere between 6 and 8 cups of water per day. That is roughly 48 to 64 ounces. For seniors with diabetes or elevated blood sugar, staying closer to that upper end tends to support better kidney function and glucose regulation. But remember, we are not trying to drink a gallon of water all at once. Consistent, steady hydration throughout the day is the goal. Let me talk about something that many of my patients have found incredibly helpful, which is creating what I call hydration anchors. An anchor is simply a routine event in your day that you pair with drinking water. You already have these routines: waking up, brushing your teeth, eating meals, taking your medication, sitting down to watch the news. Each of those is an anchor. Each one becomes a natural reminder to drink a glass of water. If you take medication in the morning with a small sip of water, I want you to take it with a full glass instead. That one change alone adds a cup of water to your day without requiring you to think about it or remember anything new. If you sit down to watch your favorite program after lunch, put a glass of water next to you before you sit. Not a bottle on the counter, a glass right next to you. Proximity matters. If it is within reach, you will drink it. If you have to get up for it, many of us simply will not bother. Now let us talk about what kind of water is best, because this is a question I get asked a lot. Plain water is always your best choice. No calories, no sugar, no additives, no complications. But I know that for many seniors, plain water feels boring or even slightly unpleasant. And if that is the reason you are not drinking enough, let us fix that. You can add a slice of lemon, lime, or cucumber to your water. These have essentially no effect on blood sugar, and they make water far more enjoyable for a lot of people. You can drink water cold, at room temperature, or slightly warm, whatever you find most pleasant. Some of my patients prefer warm water, especially in the morning, and there is nothing wrong with that. Warm water can actually be gentler on the digestive system. What I do want to caution you against is replacing water with beverages that seem healthy but are not as beneficial as they appear for someone managing blood sugar. Fruit juices, for example, even 100% natural ones, contain significant amounts of natural sugar that can cause meaningful blood sugar spikes. Sports drinks often contain sugar and electrolytes that are more relevant for athletes than for seniors managing glucose. Sweetened teas, flavored waters with added sugars, and soft drinks, including diet sodas, are not ideal substitutes for water. Diet sodas in particular remain controversial in the context of blood sugar health, with some research suggesting that artificial sweeteners may affect insulin response and gut bacteria in ways we do not fully understand yet. When in doubt, plain water or plain herbal tea without sweeteners is your safest and best choice. Speaking of herbal teas, there are a few that I want to mention specifically because they have received attention in the research literature for potential blood sugar supportive properties. Cinnamon tea made from a cinnamon stick steeped in hot water has been studied for its potential to improve insulin sensitivity. Hibiscus tea has been looked at for cardiovascular and glucose benefits. Chamomile has shown some interesting connections to blood sugar regulation in preliminary studies. I want to be careful here and clear with you. None of these teas are treatments for diabetes, and none of them replace medication or medical care. But they are pleasant, they contribute to your fluid intake, and the early research is interesting enough that enjoying them as part of a balanced approach seems reasonable. Just drink them without added sugar or sweeteners. Now I want to address something that comes up often with my senior patients, and that is a very understandable concern about drinking too much water. I hear this a lot. Doctor, if I drink more water, I will be running to the bathroom all day, and I cannot do that. I hear you. I understand. Increased urinary frequency is a real inconvenience, and for seniors with mobility challenges, urgency issues, or who simply do not want to be tethered to the bathroom, it can feel like the cure is worse than the problem. But here is what I want you to know. When you are consistently well hydrated, your body actually regulates fluid more efficiently. The very frequent, urgent urination that many seniors experience is often actually a sign of poor hydration habits, drinking large amounts at once rather than small amounts consistently. When you sip water steadily throughout the day, your kidneys can process it gradually, and you may find that urgency and frequency actually improve rather than worsen with better hydration. It takes a week or two for your body to adjust, but most people who commit to steady, consistent hydration find the bathroom situation gets better, not worse. Now, there is one more thing I need to address with great care, and that is the issue of certain medical conditions that do require fluid restriction. If you have been told by your doctor that you need to limit your fluid intake because of heart failure, certain kidney conditions, or other specific diagnoses, please do not increase your water intake without speaking with your doctor first. Everything I am sharing today is general health guidance for seniors managing blood sugar and diabetes, and it is not a substitute for the individualized advice of your own healthcare provider who knows your full medical history. If you are not sure, ask. Please ask. Your doctor wants you to ask, and getting that clarity is always worth it. Let us talk about some signs that your body gives you when it is dehydrated, because, as I mentioned, you cannot always rely on thirst to tell you. One of the most reliable and simplest ways to assess your hydration is the color of your urine. I know this sounds like an unusual thing to talk about, but it is genuinely one of the most useful self-monitoring tools available to you, and it costs absolutely nothing. Ideally, your urine should be a pale, light yellow color, similar to lemonade. If it is darker, more like apple juice or amber, that is a sign you need more fluid. If it is nearly colorless, you may be drinking more than necessary, though this is less common. Checking this a couple of times a day takes 5 seconds and gives you real information about where you stand. Other signs of dehydration that are worth paying attention to include a dry or slightly sticky feeling in your mouth, headaches that come on in the afternoon without an obvious cause, feeling more fatigued than usual, even after a good night's sleep, difficulty concentrating or a foggy feeling in the afternoon, and muscle cramps, particularly in the legs and feet, which are very common in seniors and which dehydration can worsen significantly. Many people who experience nighttime leg cramps are surprised to discover that improving their daytime hydration actually reduces the frequency and severity of those cramps. It is not a guaranteed fix for everyone, but it is a free, harmless thing to try, and I have seen it make a significant difference for many of my patients. Here is something else I want to address that relates specifically to diabetes management. One of the medications commonly used to manage type 2 diabetes, a class of drugs called SGLT2 inhibitors, brand names like Jardiance, Farxiga, and others, actually works by causing the kidneys to excrete excess glucose through the urine. This is a very effective mechanism, but it means that people taking these medications are losing fluid at an increased rate. If you are on one of these medications, staying well hydrated is not just good advice. It is especially important for protecting your kidneys and maintaining the safety profile of the medication. The same applies to any medication that has a diuretic effect. If you are not sure whether any of your medications increase your fluid needs, your pharmacist is an excellent resource and can answer that question for you clearly and quickly. I want to take a moment here and talk about something beyond the physical, because I think this matters. Many seniors that I work with feel overwhelmed by the number of things they are supposed to do, monitor, take, and avoid when it comes to managing their health. The medication schedule, the blood sugar checks, the dietary restrictions, the exercise recommendations. It can feel like a second job, and an exhausting one. And when someone adds "drink more water" to that list, it can feel like one more thing to fail at or forget. I want you to hear me when I say this. Improving your hydration is not one more burden. It is actually one of the simplest, most accessible, least expensive, and most immediate things you can do to support your health. You do not need a prescription. You do not need a special device. You do not need to go to a clinic. You need water, a glass, and a little intention. And the results? Better energy, clearer thinking, more stable blood sugar readings, less strain on your kidneys, fewer headaches, fewer cramps. Those results can come faster than almost any other lifestyle change you make. I want you to think of hydration not as a chore, but as one of the most fundamental acts of self-care available to you. Every glass of water you drink is a small but meaningful investment in your own well-being. Every time you choose water over a sugary drink, you are making a choice that respects your body and supports the system that is working hard every day to keep you going. I do not say that to make you feel guilty when you fall short. I say it to help you feel genuinely motivated when you get it right. And most days, you can get it right. It is one of those rare health behaviors where the gap between where most people are and where they should be is genuinely not that wide. Let me give you a simple, practical plan that you can start tomorrow morning. Actually, you can start today if you have a glass of water near you right now. Go ahead and drink it while I keep talking. Here is the framework. Wake up and drink 1 full glass of water before anything else. With your morning medication, take a full glass instead of just a sip. Before breakfast, drink a glass of water. Before lunch, drink a glass. In the mid-afternoon, around 2 or 3 o'clock, which is typically when energy dips, dehydration peaks, and blood sugar can become erratic, drink another glass. Before dinner, drink a glass. That is already 6 glasses, spaced through the waking hours, delivered at times that support your blood sugar, your digestion, and your kidney function. You can add a glass of herbal tea in the evening if you would like something warm and comforting. And if you find yourself thirsty at any other point in the day, honor that signal. Your body is asking for something it needs. If you want to track your intake, and some people find this genuinely helpful and motivating, while others find it stressful, you can use something as simple as a piece of paper with 6 boxes on it and check them off as you go. Or you can fill a large pitcher in the morning with your target amount for the day and watch the level decrease. Or you can set gentle reminders on your phone at the times I mentioned. Or you can simply rely on your hydration anchors, the routines I described earlier, and trust that if you are consistent, the habit will take care of itself over time. There is no one right method. The right method is whichever one you will actually stick to. I want to close by circling back to something I said at the very beginning. This is not just about drinking more water. It is about understanding your body well enough to give it what it needs at the right times, in a way that fits into your real life. You have already done the harder work of showing up to learn about your health. You are here, watching this, which means you care, and that matters. The next step is just as simple as lifting a glass. If this video helped you, I hope you will share it with someone you love, a spouse, a sibling, a friend who is managing diabetes or watching their blood sugar. Sometimes the most meaningful gift we can give someone is a piece of information that makes their daily life a little easier and their health a little better. And if you have questions, leave them in the comments below. I genuinely read them, and your questions often inspire the next video. Thank you for spending this time with me today. Now drink your water, take good care of yourself, and I will see you in the next one.